Hello friends, let us now learn some important points about the routes of drug administration. So in the routes of drug administration, one we have systemic routes, second we have local routes of administration. So in the systemic routes of administration, first we have intranasal routes. In the intranasal route, we have peptides which will bypass the blood-brain barrier and they are used in CNS, and these intranasal routes are the only through this only the potent drugs can be given. The benefits are these intranasal drugs have rapid absorption and they have good effect in central nervous system and they are easily self administered. Examples of intranasal drugs include desmopressin, growth gonadotropin releasing hormone agonists, calcitonin and fentanyl. Then we have second systemic route, which is called as inhalational or pulmonary route. This inhalational or pulmonary route is of two types. One, we have systemic drugs can be given through inhalational route or local drugs can be given through inhalational route. So in systemic drugs through inhalational route, there will be no first pass metabolism and there will be rapid absorption and effect is seen. Example, the drug Afrezza is given for postprandial hyperglycemia. So this is important drug in inhalational or pulmonary route. Then if you see the local route, this local route has less systemic side effects. So example of drugs given in local route are bronchial asthma or COPD. So these bronchial asthma or COPD are beta 2 agonists or steroids or anticholinergics or pseudomonas and pneumonia. They can be given for pseudomonas pneumonia, like for tobramycin can be given for pseudomonas pneumonia through inhalational route, or for influenza zanamivir can be given for influenza through local route. So that is inhalational. Then we have third route, which is sublingual. Sublingual has rapid absorption or effect. It also does not have first pass metabolism. After the adequate effect, the drug can be easily spit out. So drawback of this sublingual route is because this drug is put in our mouth, it can cause teeth decay or it can cause teeth discoloration. This also increases the risk of cardiac side effects also. The examples of this drug are nitroglycerin, nifedipine, isosorbide dinitrate, ephedrine, buprenorphine and ergotamine are given through this nitroglycerin. Especially for angina, we can use the nitroglycerin sublingually whenever the patient experiences pain, and once the pain decreases, the drug can be spit out so that you won't have excess toxic dose. Then fourth route is oral route. Oral route is most commonly used and it is the cheapest route, most convenient and the safest route to be given. But the drawbacks, if you see, it has most variable absorption and first pass metabolism because many drugs are not absorbed by oral route. Right? Next, this is about the oral route. Then there are some drugs which cannot be given by oral route because they are being degraded in the intestines and stomach through its enzymes. So we have ACE. The drugs ending in ACE are enzymes which, like asparaginase, they cannot be given. The drugs ending in tides like peptides like octreotide cannot be given, and the drugs which are ending with MAB, which are monoclonal antibodies like abciximab, these also should not be given. And there are certain proteins with large molecular weight which are not given. So these drugs are not given because all these are actually proteinaceous in nature and they are degraded. Then the fifth route is intravenous, which is the only route with 100% bioavailability. It is the most rapid use, it causes most rapid effect, so used in emergency. Large volumes can be given through intravenous route, and even the drugs with higher molecular weight can be given through this intravenous route. The drawbacks of this intravenous route are this will increase the risk of toxicity, especially acute toxicity, and if there are drugs in oily medium, it can cause hemolysis of drugs in oily medium. So if you see the examples, paroxysmal supraventricular tachycardia, adenosine can be given for paroxysmal supraventricular tachycardia. Furosemide IV can be given for pulmonary edema. Nicardipine IV can be given for hypertensive emergencies. Lorazepam IV can be given for status epilepticus. Right, this is about the intravenous route. Then sixth systemic route is intramuscular route. This intramuscular route, here drugs are given in oily medium, or they are respiratory, or they has respiratory vehicles. Okay, here these drugs are given by IM route. So irritants can also be given by IM route. This intramuscular route delays absorption, so it is long acting. So if you see the drawbacks, here the drug is in oily medium, so you will see that on injection there can be pain on injection. So examples of these IM drugs are, we have benzathine penicillin. Here we can use drugs like benzathine penicillin, monoclonal antibodies, and adrenaline can be used. Then we have the next route, which is the seventh route, which is subcutaneous route. In subcutaneous route, this will actually delay the absorption of drug, causing long duration of action. Self-administration is possible in this subcutaneous drugs. So if you see the drawbacks, in the drawbacks, subcutaneous route drugs, through subcutaneous, irritants cannot be given because these irritants will irritate the subcutaneous tissue, leading to pain and necrosis. Examples are insulin, monoclonal antibodies, and octreotide. Then we have the next route, which is called as rectal route. In rectal route, there is 50%, this is given 50% lesser and first pass metabolism compared to oral route. This rectal route is an unpleasant drug can be given through rectal route. But the drawback for rectal route is it has variable absorption. Examples are, through rectal route you can give diazepam per rectally for febrile seizures in children. So this is about the 8th systemic route, that is rectal route. Then 9th systemic route, which is transdermal. In transdermal, drugs which are long acting or slow absorption can be given through transdermal route. These drugs have no first pass metabolism. So if you see the drawback of transdermal route, only through transdermal route only lipid soluble drugs can be given through transdermal route. Okay, examples are, if you see, we have clonidine, nitroglycerin, scopolamine, and fentanyl and nicotine can be given through transdermal route. Clonidine, nitroglycerin, scopolamine, and fentanyl and nicotine can be given through transdermal route. Then the 10th systemic route is intradermal route. Intradermal route has the slowest absorption by parenteral route. So uses of intradermal route are, this can be used for sensitivity testing, like we can use it in tuberculin test or drug hypersensitivity, especially beta lactam hypersensitivity testing we can give through intradermal route. Then we have one more route called as local route. Okay, the next route we have done with systemic routes. Now we have local routes. Local routes are, first we have topical route. In the topical route, first we have cutaneous route, which is steroids, antibiotics, and immunosuppressants are given through topical route, cutaneous topical route. And through mucosal route we can use cystitis, which is polymyxin B is given for cystitis. Bladder cancer, for bladder cancer, anti-cancer drugs can be given by mucosal route. In vaginal candidiasis, fluconazole is given vaginally, that is through mucosal route. Then one more topical route is ocular. Through ocular we can give anti-glaucoma drugs, analgesics, and antibiotics can be given through ocular route. Then the second is we have intrathecal route. Intrathecal route, if you see, these drugs have lesser systemic toxicity. And through intrathecal route, this is used for drugs which don't cross blood-brain barrier. Examples of these intrathecal route drugs are methotrexate, which is used for leukemia, and we have methotrexate used for leukemia, and we have aminoglycoside drugs which are used for CNS infection. And then we have baclofen, which is used for amyotrophic lateral sclerosis. And then we have, through the intrathecal route, we give midazolam also. There are also some local anesthetics which can be given through intrathecal route. Third is intra-articular route. Intra-articular route, we give steroids through intra-articular route for like rheumatoid arthritis. Then the fourth route is intra-arterial route. Through intra-arterial route has lesser side effects and lesser first pass metabolism. Intra-arterial route, we have lesser side effects and lesser first pass metabolism. If you see the examples, anti-cancer drugs can be given through intra-arterial route, especially for head and neck cancer and hepatocellular carcinoma. So this is about the different routes of administration. Thank you for watching.